Good morning, dear students. In this video, we will be seeing about a review of serious adverse event SAE reports. This is a continuation part of the previously discussed reviewing process in IRB. Up to now, we had seen about the composition of institutional ethical committee, and also we have seen about the process of meeting also. So let us continue our discussion. So this type of reviewing will be observed in between the research activity, because once the research work got started, in between expected and or unexpected type of adverse events will be observed during the process. So during that time, what is the role of ethical committee and what procedure they are following for reviewing such serious events, that we are going to discuss under this topic. So let us see what is this serious adverse events. So these serious adverse events reports consist of very serious incident which will be observed during the treatment. Sometime it may, in terms of death or disability, can be observed with the patient. Even hospitalization can also be seen. Such incidences are called as serious adverse events. So how to handle that, and whether to stop the study or whether it can be continued, so that is the decision making by the committees. So now, what is the purpose of this SOP? Means it will provide instruction to review and follow up the reports of serious adverse events. So now, how to handle the situation by SOPs it will be mentioned. So now here two types of events you may come across, that is the expected adverse events and unexpected events. So already the study is ongoing, because IRB had given permission for such studies, but it's a responsibility of IRB to check in terms about the any essay is reported or not. So when to report this essay? So it should be reported very immediately by the investigator, preferably within 24 hours of the incident. It should be reported to the IRB, so that they can take the decision. So now here unanticipated risk factors can be observed during the course studies, because it may not be known earlier. So now here we have to check about the risk benefit ratio before terminating the study. So risk benefit ratio should be checked. So a study they will conduct, that is the PSUR, periodic safety update reports. Such reports should be submitted to the IRBs frequently, monthly wise at least, periodic safety update reports. So there they will analyze about the risk and benefit. So this ratio will be taken, and they will ensure adequate protection of the welfare of the study participants, and if risk is negligible when comparing with the benefits, in such condition there may be continuation of the research work. So now let us see what is the scope of this SOP, because this SOP is going to give a guidance for ethical committee members to check about the SAE. So IRB responsibility. What are the responsibility of institutional review board? So here few of the responsibility we can see in the slide. So first they are going to review and address the SAE and unexpected events also. So in addition, the committee is authorized to mediate within the participants if participants are not in a condition to respond, so that family people can also be contacted to have a discussion about the SAE. Even IRB should make sure that the research are made aware of the policies and procedures concerning reporting and continuing review requirements. As we know, like primary education should be given for the study participants, and IRB also should get complete information. So this is the work the researchers they are going to do, is continuing review requirements they are going to fulfill. So the IRB secretariat is responsible for receiving the complete SAE or unexpected events reports, because he is going to make the decision at the end whether to continue or not. The member secretariat to present the SAE report in the IRB meeting. So now let us see about different types of serious adverse events which can be observed. The adverse events is serious and should be reported when the patient outcome is any one of the following enlisted events. First, it may be the death. Report if the patient death is suspected as being a direct outcome of the adverse events. Or second possibility, it may be life-threatening because what the treatment have been given to the patients, sometimes substantial risk of dying may be observed at the time. So now some of the example which include like pacemaker failure or gastrointestinal hemorrhage, bone marrow suppression, infusion failure. So many of these examples suggest like future there is a chance of failure or death can be observed. Or sometime it may be hospitalization, so it may be initial hospitalization or prolonged hospitalization. In such condition also it should be reported, examples which includes anaphylaxis or pseudo membranous colitis or bleeding which can cause prolonged hospitalization. So this all comes under the SA reporting, and even sometimes disability happen to a patient. So in such condition also it should be considered as SAE. Disability in terms like impairment or damage or disruption in the patient body function or structure, or physical activities or quality of life may be worsened. Such disability may happen. Example is cerebrovascular accident due to drug induced hypercoagulability or toxicity, or peripheral neuropathy can be seen, such that the quality of life may be disturbed. So all will come under the SA reporting. And other example which include the congenital abnormality which can be observed during conception or during pregnancy. So example, it may be vaginal cancer in female offspring. So during the treatment procedure it may happen, or malformation of offspring caused by the drug. Previously it was observed that is the thalidomide. Such things also comes under serious adverse events. So now in such condition, what are the detailed instructions this ethical committee people they will be following, that let us see. So before each IRB meeting, so now safety assessment related to the serious adverse events related activities should be presented before the IRB committee during the particular meeting. So now here IRB secretariat will verify that the reports are complete and signed and dated. So in case like if we observed what the report is presented is incomplete, so that such reports may be sent back to the primary investigator. It's a function of primary investigator to check that properly the report is made and it is signed and dated also, because we are told within 24 hours it should be reported. Now let us see what are the criteria they will follow for reviewing. The review criteria can be enlisted as follows, like assessment of adverse experiences unknowingly or unlikely. Report is forwarded to the chairperson for reviewing. After assessing the report is forwarded to the chairperson for reviewing and determination whether the report should be reviewed at the convened meeting or whether full body is required or not. So all the decision will be made, because here the quora should be framed. So for that complete reviewing they are going to do. So now the assessment of the report they are going to check with the SA report as per the criteria of GSR 52E with amendments of 12th June 2015 is a gadget notification which got come across with the SAE, serious adverse events, how to manage it. So according to that compellence they are going to check. So then they are going to report such events in full board committee, because here they have to fix the agenda for calling the meeting. So for that purpose, so they are going to fix the agenda by observing the report, and they may call for the full board meeting if required. So now many times what will happen means, like already one center they have reported about the adverse event which have happened or SAE, and by observing the risk as well as benefit ratios, so they may be continuing the study, or sometimes the second center, because sometimes multi-center studies will be carried out for clinical trial. The second center people, they may come across with the same type of complaint, because already it have been noticed in the previous meeting said that here there may be not requirement of calling full people or member for the meeting purpose. For reviewing, here chairperson is enough, or other qualified ethical committee members and a secretariat may be enough. There is no requirement of calling full, because already the decision is made in the earlier meeting itself. Because multi-center wise, separately the reports may be reaching towards the ethical committees. So now during the IRB meeting, they are going to review, and after reviewing they are going to discuss about this. So after observing the report, the chairperson entertains discussion on the study and similar adverse experiences or advisories. If appropriate to the discussion, the chairperson or another IRB member may be called for consensus, because here we cannot stop the study immediately. So risk as well as harm benefit we are going to check. So in such conditions, a meeting will be conducted and a chance will be given for the investigator to explain. So there may be chances that IRB member, after getting complete information, so they may request an amendment to the protocol or the consent form which is used, or it may be request further information related to the study what they are doing, or the committee may suspend or terminate the study. So this in further slides will be seeing about the decision making procedure by the IRB meeting. Now coming with the information investigator or licensing authority, so what they are going to do. So now here IRB secretariat member drafts a formal letter, because the report should be sent to the primary investigator. So they are going to send this letter to the investigator or licensing authority, what decision have been taken during the EC committee meeting. So that will be sent. So this will be signed by the chairperson, and date will be mentioned in the letter, and send the letter and record. The delivery date also will be mentioned. Now coming with the compensation for the research related harm, because continuing with the SAE studies, so there may be chance of death, or sometimes disability also may have observed, death also observed. In such condition, how the composition will be given, all will come under some regulation of the certain government according to chapter 6 of the New Drug and Clinical Trial Rule 2019, number 43, titled Medical Management and Composition for Injury or Death Relating to Biomedical and Health Research. So that will be overseen by the Ethical Committee for Biomedical and Health Research, and they are going to follow this National Ethical Guidelines for Biomedical and Health Research involving human subject. That's ICMR 2017 India. So here a detailed version, they are explained about the composition, what should be given in case of death or in case of permanent disability observed. So now these have some recommendations. What are the recommendations these guidelines says? Now research participants who suffer direct physical, physiological, social, legal or economic harm as a result of their participation are entitled, after due to assessment, to financial or assistance to compensate them equitably for any temporary or permanent impairment. So here assistance may be in terms of finance or any other compensation may be given. In case of death, participant dependents are entitled to the financial compensation. So in the next video, we will be continuing the discussion